across the world, healthcare provision is seen as a public good. Nobody can actually debate around that. And that is simply because it's in our nation's interest for everybody to be in good health. However, the private sector does have a role. There are certain things that the private sector, and we've shown this through research and analysis, there are certain things that the private sector does better than the public sector. So one of them that comes at the top of my head is actually infrastructure. A lot of what we call public-private partnerships, and especially as defined under the Kenyan Public-Private Partnership Act, are very strongly infrastructural based, and that actually comes from the feeling that the private sector has capital, and so if you can tap into that capital to actually ensure that you actually have the necessary infrastructure and equipment to actually help a government meet its agenda of improving health, then that's actually a good thing. But how do you do this responsibly without making the prices too high, for instance, for the very people that you're supposed to be providing the services to? There are unique mechanisms that have actually been used to get this right. Some of them are contractual agreements where, if I may go to a very basic example, if you go to Kenyatta National Hospital, the radiation department for mostly used by cancer patients undergoing radiotherapy, you'd actually, I think the last I had, which is just a couple of months ago, there's a waiting list of up to 7-8 months. So you walk in there, you have cancer, you need radiation, you have to wait for 8 months before you can actually have the radiation. There are private hospitals that actually have the equipment, which is not as busy, and it's actually available. And some of it is perhaps used during the day, and they're not used at night. It's not rocket science to think that the government can actually partner with certain people under certain agreed arrangements where the government provides a huge number of patients at highly subsidized costs, and the private sector allows these procedures to be done. Because remember, some of these treatments have to go concurrently. So if you're supposed to have chemotherapy and radiotherapy structured in a certain way, everything else is messed up. All these kind of arrangements where you can even do contracting for staff as well. Do you need to actually have an anesthesiologist? Do you need to have orthopedic surgeons, for example, on your payroll? And yet you're underpaying them. You are underpaying them, they are costing you a lot of money as a county, and you're not actually getting value for money, and they are not happy, so they actually spend a lot more time doing their own private practice. Why can't you have a system where you actually contract them specific days or specific hours to offer the service, and they remain private sector players, and you actually pay them well for that? You can actually do that and actually spend less at the end of the time. Finally, I think for medical technologies and specifically medicines as well, and supply chain, especially what we call supply logistics, and what I was referring to earlier as last mile delivery of medicines. Again, pretty much anywhere you go where this is working very effectively, the private sector is highly involved. They just seem to get it better. They just seem to plan the distribution circles, the mechanisms better. They just seem, to respond a lot faster. They just seem to engage better with negotiations with suppliers, because it's something that they do. So again, this is something that the public sector can actually tap in and just work with what we call third-party logistics suppliers to actually make sure that the government focuses on its core mandate in healthcare, which is policy, regulation, standards, and just making sure that everything else is working okay. You see, if you want to make the private health sector work for the public without introducing that financial strain to an already poor population, then health insurance is a solution. So if somebody has insurance, remember, if you provide insurance, you're empowering the patient. You've basically moved power away from the providers to the patients. That's basically what we call demand-side financing does. That's what insurance does. So if I'm insured and I have a choice of where I can go, then actually have a lot of power. Now, that is one thing. The second thing is, as long as there's that insurance that is supplied by that cover that is actually provided by a strategic purchase of healthcare services, it will be in their strong interests to make sure that the facility, they're getting value for money from the facility. So no tricks. As an insurance, well, I don't care whether a patient has gone to the public or the private sector. All I care is that what I'm paying for is value for money. So the insurance is actually a very, and especially if well-intentioned and well structured, is actually a very strong driver for lowering prices, and especially in the private health sector.